Hi everyone. Tonight, this is the fourth in a series of videos that I'm doing on kitchen herbs to help with inflammation. Tonight, I'm talking about rosemary. And rosemary, also known as Rosmarinus officinalis, has been used for centuries in Mediterranean medicine. Modern research has confirmed that it has several compounds that fight inflammation, protect cells, and boost brain health. One thing that it does is it suppresses inflammatory markers like COX-2 and tumor necrosis factor alpha. Suppressing these helps to calm joint pain, helps with muscle soreness, and helps with rheumatism. There is one key compound, carnosol, that has been linked to these effects. Another thing that rosemary does is it acts as an antioxidant shield. It has high levels of polyphenols such as carnosic acid, rosmarinic acid, and ursolic acid. And so since it has these antioxidants, it helps to protect your liver, your brain, and your heart from oxidative stress. This means that you have less cellular damage, better all health, and potentially less aging. Another thing that rosemary does is it improves cognitive enhancement, and it is an established neuroprotector. It is brain food. It possibly inhibits acetylcholinesterase, which is the enzyme that breaks down acetylcholine. Since this will cause an increase in the acetylcholine levels in the brain, we have seen improved effects in patients with Alzheimer's disease. Research has suggested that it can improve memory, concentration, and mental clarity. There is some preliminary evidence that shows that it may reduce the amyloid plaque buildup in Alzheimer's, but the studies are too few to make a definitive statement regarding that. Another thing that rosemary does is it helps with mood, it helps reduce your anxiety, and it helps to reduce stress. We have statistically significant data that shows that in aromatherapy, rosemary acts as a natural mood booster, and that inhaling the essential oil can reduce cortisol levels. Cortisol is the stress hormone. So if you're able to reduce the stress hormone, not only is it going to promote calm and cause your mood to be better, but it's also going to make you healthier, because cortisol is the hormone that kicks in when you're stressed and you can't do anything about it. So if you reduce that cortisol, you're going to be healthier long term. Another thing that rosemary can do is it is an antimicrobial. It contains compounds that fight gram-positive bacteria. An example of this would be Staphylococcus aureus, or staph, and it fights fungi such as Candida albicans, which is yeast. So this is a lot of times why you will see rosemary oil as a preservative in personal care products, is because it acts as a natural antimicrobial. Another thing that rosemary does is it promotes digestive health and liver health. Rosemary is a carminative, an antispasmodic, and a cholinergic, meaning that it helps with digestion. It can reduce bloating and gas, and it also stimulates bile flow. If you stimulate bile flow, you have better fat digestion and metabolism, and so your liver is healthier overall. Lastly, rosemary can be used to help with scalp health and potentially stimulate hair growth. If you apply rosemary oil to your scalp, or you rinse your hair with a rosemary tea, rosemary stimulates the blood vessels in your scalp, and this stimulates the hair follicles. So you get better circulation, and not only does this potentially trigger hair growth, it can also reduce dandruff. In fact, in a clinical trial, Rosemary oil was found to be just as effective as minoxidil, which is a common hair loss treatment. So, as you can see, rosemary has many, many uses other than just seasoning food. Like any other herb or alternative medicine protocol that you're interested in trying, please talk to your healthcare professional first. You want to verify that anything that you want to try will not interfere with any pharmaceutical medication that you're taking, or it wouldn't cause any conditions you have to be triggered or to become worse. So that's all I have to say tonight about rosemary. Thank you for listening, and I will see you next time. Thank you. Bye-bye.